Thank you very much, David, and most welcome to all participants in this webinar. I have seen greetings coming from all over the world, so I should say good morning, good afternoon, good evening, because coming from Australia, and I see at least one connection from Australia, it must be already evening there. And in Colombia, I'm quite sure it's still morning. So you're coming from everywhere. I saw Togo, India, Bangladesh, Burundi, Pakistan, from many sides of the world. And I would like to thank you for this. We are extremely happy to have today David Nabarro, my predecessor as Sun Movement coordinator. But right now, he's a special envoy for the COVID-19 crisis, and he's advising WHO and many others about how to deal with this COVID crisis on short notice, but also on the longer notice. David Nabarro, most welcome. You are giving interviews, you are giving webinars and speeches everywhere. I would like to invite you, to welcome you here to everyone, but I would like you to focus on where we are exactly in the crisis. But I want you to make a connection between how to respond and behave vis-a-vis the crisis related to the importance of nutrition. Nutrition is important within this crisis situation, but also for the recovery and the longer term. It is crucial. So I also hope that you, in your contribution of during the next 10-15 minutes, will reflect what we as partners and members of the Sun Scaling Up Nutrition Movement could do to mitigate the crisis, to support people wherever they are, and to build back better out of this crisis. So extremely honored to have you in, David, and you have the floor. Over to you.
Well, thank you very much indeed, merci, and how wonderful to be with everybody. Of course, time is short. I won't say all the messages that I want to give to each of you, but just simply, please know that it is just wonderful to be back with the Sun Movement family. One of the most wonderful things that I've been able to do in the recent past. I'm here with Florence, and we're both very pleased to be connected to you. Just a few words at the beginning about the COVID and what's happening. And I'll do that in headlines because I know that really the focus is going to be on nutrition. This is a virus about which the world has known for just over 5 months. It's a dangerous, stealthy, and surprising virus. And it's here to stay and not going away. It'll probably be at least 2 years before a vaccine against the virus is available for everybody in the world. Even though there's a lot of work underway now to develop it, we must remember that the time between having a candidate vaccine or vaccines and then producing them and making sure they're available safely for everybody and then getting them to everybody, that takes time. So what I'm talking about at the opening remarks here is the actions that everybody is going to be needing to take in order to live as safely as possible with this dangerous virus in our midst until a vaccine enables us to be free of the threat. There are some vital steps being taken by every single country everywhere to try to reduce the risks posed by the virus, and in particular to make sure that every community everywhere can defend themselves as fully as possible, reducing the rates of infection, making sure that if an infection does develop, that it can be contained as quickly as possible through isolating people with the disease and finding their contacts and isolating contacts, at the same time protecting those who are most at risk, which are older people and people with other illnesses. At all times, we have to make sure that health services are strong, both public health services in the community and hospital services as well, so that the threats to health workers are kept as low as possible. It's tough to do anywhere. It's particularly tough to do in places where there's just not much in the way of resources, especially as the testing to find out who's got the virus is not easily done in any country, and least of all in countries that just do not have strong laboratory facilities. There are some false choices being proposed around the world, and I just want to be clear about one thing. It's not a choice between keeping the economy going on the one hand and looking after public health on the other. Given the way in which this virus spreads and outbreaks can build up super fast, very, very big, very quickly, what you have to do is to get on top of the health problem in order to get the economy working again. It's not a choice, despite what you might read in the newspapers. There's also sometimes a false choice between ensuring that there is surveillance to find disease and enabling individual liberties. Again, it's a false choice. We have to be able to ensure surveillance in order to be able to get the liberty we need to go about our lives with the best possible opportunity. Now, COVID is revealing inequities everywhere. It's very hard to control COVID in densely populated settings like the kind of urban communities in India like Mumbai or Delhi or Ahmedabad or Chennai, where there are very difficult outbreaks emerging. COVID is hard to control in situations where people are working very close to each other. And often these are poorer people working in settings where there is not opportunities for separation, because to reduce the risk of COVID, we have to maintain physical distancing. We may have to also wear facial protections. And those are just hard to do. And COVID is causing huge problems in residential care settings, particularly for older people or detention centres or prisons. We've got reports of challenges in prisons in many, many parts of the world right now. COVID is tough on hospitals. It affects doctors and nurses and others who provide care. COVID is difficult in ships where the crew are close together. And then if crew are infected, if there are passengers in the ships, they get infected as well. Crew is tough in military settings, in barracks, in military vessels and so on. Basically anywhere where people are living in very close circumstances. But also, as well as revealing inequities, COVID is giving us opportunities to reimagine ways in which we live, ways in which we work, and ways in which we undertake our social lives. It's not going to be easy, but any big behavior change, especially one that's going to involve 7.8 billion people making changes quite quickly, these are tough to do. And what I'm encouraging everywhere is that people should have as much opportunity as possible to get access to information about COVID, particularly that's been analysed by the World Health Organization to test out whether or not it's helpful. I'm also encouraging debates everywhere so that people can make sense of this new threat. I am saying that we can only deal with something like this through unity of purpose and tolerance and respect for each other, and particularly different political parties coming together and working on COVID together. I know that sounds a bit odd, given that there are some huge, major chasms and suspicions between political leaders around the world, and they are affecting even our multilateral system, the United Nations system and the World Health Organization. But quite honestly, unity is the only way to deal with this, and recognizing it's the power of humanity that's going to get us on top of COVID. Now, COVID as a virus and the containment measures that are being adopted, particularly movement restrictions for physical distancing, is having an impact on food and nutrition systems everywhere. We're seeing in many places shortages of food in markets and quite significant rises in prices. We're also seeing markets closed or deserted in some places, with demand being reduced. Crops are being damaged or left unpicked as farm laborers return to their homes. And I mentioned COVID was a revealer, and some of what has been revealed about food and nutrition is clearly laid out in the latest Global Nutrition Report, which looks beyond global and national patterns to reveal significant inequities at the local level in outcomes related to nutrition. There are some things that need to be given really immediate attention. The first is to do everything possible to enable poorer people to access the nutritious foods they need for themselves and for children, because children are not being able to access normal nutrition support services. They're not getting school meals, they're not getting preschool meals. Nutrition is an absolute priority in this time of COVID, and it's going to remain a priority because food and nutrition systems are being affected. But also livelihoods are being affected. And let's remember that in many countries, the majority of people are in the informal economy. And as movement restrictions are being put in place, we're finding that poorer people are just not being able to maintain their livelihoods. They're becoming more poor. And this is particularly applying to people in food systems, and particularly women. And so farmer organizations, labor unions, local NGOs, and of course, the whole beauty of the Sun movement at country level, as well as at global level, has an enormous role to play in identifying livelihoods that are in need of support and working on this. This is tough work. It's political work, and it's not easy, and especially as funds are tight. And who's finding particular problems with funding? It's the non-governmental and society organizations who have such a vital role in supporting people in need and who are such an important part of the Sun movement. The businesses also have an important role because farmers are finding it hard to keep production going. Consider West Africa, where the planting season is coming up. Farmers are finding it hard to get inputs, and businesses need to be able to get the inputs to the farmers so that they can plant, so there's not going to be more food security, more nutrition, more food insecurity, more nutrition insecurity in coming months. And for farming, it's tough because markets are not working well, and particularly those farmers who produce perishable goods like dairy, like poultry, like livestock meat, and also fruit and vegetables, so important for nutrition. They're not able to get their produce to markets in many settings, and produce is being plowed back into the field. So anything we can do to keep markets working for farmers' produce, especially perishables, so that the produce can be got from field to market, despite the failure of many marketing systems, is so important. I'm getting reports, particularly in Southern Africa, of new opportunities being created to get produce from farm to market, bypassing the normal market system so that food does not get wasted. What a tragedy if food is wasted, particularly nutritious food, and can't get to people who need it the most. And then people are going to have to face further food insecurity and further malnutrition. And to do all this, small and medium enterprises are absolutely critical. And there are many, many small and medium enterprises all over the world, in the developing world, as well as in middle-income countries, as well as in higher-income countries, that are going bankrupt because they just are not getting their income. And a big, small and medium enterprise rescue system, as well as a massive farmer rescue system, is essential, as well as ensuring that poorer people are not getting food insecure and not getting malnourished. And that's where logistics are absolutely critical. But what's happening, particularly within countries, we're getting logistics disrupted, but also across borders, there are tremendous disruption to logistics, which is inhibiting food supply chains from working. The Sun movement is key. The Sun movement is a movement that brings together all stakeholders at local level, national level, and internationally. The Sun movement has networks that include civil society and business, as well as including the UN system and other actors, as well as making sure that within the Sun movement, we have all the different stakeholders coming together, and the donors are there to support it. I do hope that we can be paying attention to the key actors, stop civil society from being short of funds so they can do what's necessary, put nutrition high on the political profile, because if nutrition gets impaired through containment actions for COVID, what a disaster. I've seen some estimates from Lawrence Haddad and others suggesting that the situation is very, very serious. So please, throughout the Sun movement, take on the process of dialogue around the future and recognize we're all learning how to live with COVID as a constant threat. We're going to have to do it for the foreseeable future, learning from each other, which is what the Sun movement does so, so well. Thank you for the chance to share with you for a few minutes. I'd like to stop now because I know you've got lots of questions, and hand back to the Sun Movement coordinator and thank her for really showing that food systems, nutrition systems, livelihood systems, farming systems, they're all interrelated and have to be looked at together, because without that, we get poor nutrition, and poor nutrition has such long-term consequences, especially for women, especially for children, and the first 1,000 days being so massively important. Thank you.
Thank you, David, and I applaud you on behalf of all the participants, because while you were speaking, I was observing the messages that are already coming through, and we're trying to bring them into concrete questions to you. But let me first address one or two questions that are put on in the chat box about French language. I'm sorry to let you know that we don't have translation into French and Spanish that we normally will have, but this is such an extraordinary situation and opportunity to have David, that David is speaking loud and clear and not too fast. I also try to speak loud and clear so that you can follow what we are doing, and you can put your questions in French and Spanish, and we have David and Diana to translate these questions in order to put them in front of David Nabarro. So thank you very much, David, for making the connection in every phase of the crisis with nutrition, the pushing for a joint approach, a multi-sectoral, multi-stakeholder approach, push for making sure that civil society organizations and people movements can continue to do their job, that companies are contributing, especially small and medium-sized companies as well, and that donors and UN are also supporting what is happening in countries in a joint and aligned way. I have already 3 questions for you. One is coming from Lucy Vidasari, and she asks you how can we solve the stunting during and in post-pandemic COVID-19 times, because the pandemic will affect the economy and may increase poverty. The second question is coming from Lakshmi, and Lakshmi asks, when will the COVID-19 crisis end from the world, and how to link nutrition, how to put nutrition at the center of the debate in and after the pandemic times. Then a third question so far, and then I propose that you will respond. A question from Chris Leder. He's talking about, does there need to be a shift in trade, agriculture and development policies to promote local food systems which are more resilient to international shocks, such as pandemics, and help people access healthy diets? If so, where does the responsibility lie for making this shift happen? David, over to you while we are collecting more questions.
Thank you very much indeed. By the way, as I look, I try not to, but as I see the chat ones come up, I see lots of current and former colleagues and friends are on this call. Once again, I wish I could greet each individually, and I hope that colleagues will follow up with me through further if my answers are unsatisfactory or incomplete. I do really want to stress that COVID is a new virus that has announced itself to the world in an absolutely horrible way. And the challenge for everybody now is to learn to live with this virus as a constant threat and to maintain our economies with this virus as a constant threat. This is a huge learning exercise, and it's undertaken by all stakeholders, government and the rest of us. And so let's try to recognize that what a lot of the answers I will give will reflect my understanding as it is today, but that may evolve as we learn more about it. And so we must recognize that COVID has been so horrible. Governments have moved very, very quickly to try to reduce the rate of transmission, to reduce the number of people affected, to lock the virus in place. And the way they've done that is through imposing movement restrictions on their populations. Right now, more than half the world is in the middle of movement restrictions, and they really do precipitate poverty. And governments everywhere have said, while we get ourselves ready to build up defenses against this new virus, at the same time, we will impose the movement restrictions to stop it in its tracks. And then we will release the movement restrictions and try at the same time to stop infections building up again, overwhelming our health services, and also actually affect people and kill them. So there will be increased poverty as a result of the movement restrictions, what some people call lockdowns, by the way. And that is a reality. And so governments are having to try to find ways to limit poverty by getting income to people, particularly poor people, particularly people in the informal economy. And if they can't get income to them, at least get food to them. And I would like to be able to say they're also trying to get nutrition to them. But let me stress to all of you that I don't think nutrition is top on the agenda of many governments. And it's our job to highlight the reality that acute poverty, acute sudden poverty, will lead to poor nutrition unless it is prioritized, particularly poor nutrition of women, especially pregnant women, and of children, to an increase in stunting, and almost certainly a pretty big increase in wasting as well. So what we have to do is to say, please remember that inside all this effort to contain COVID and restricting movement, you are inevitably going to have increased poverty. And that will also be associated with food insecurity and malnutrition. And you have to prioritize it. And although the children will not be protesting in the street, they will be getting hungry and they will be getting thinner. And you must include in all programs to support people, all your social protection programs, please have a strong nutrition element. And that will not be normally number one on the priority of governments, not all governments anyway. And so that's our job in the Sun movement, to keep making that point, because there'll be a lot of new people involved suddenly in poverty reduction. And really, we have to be reminding them that the child who gets malnourished almost certainly will be affected through into adolescence and adulthood if action is not taken now. We've known from wars, we've known from crises, that sudden periods of food shortage, even for several months, can have long-term impact on child nutrition and well-being. Now, I do hope that the lockdown period will end quickly and that governments will be able to have defenses against COVID in place in all societies, but they'll get rebound outbreaks occurring. And some outbreaks will be very hard to deal with, particularly in very urban areas. And so I don't want to say that COVID is going to end. I don't want to say that COVID outbreaks are going to end, but I'm going to say that governments and communities and businesses and civil society will get cleverer and smarter at responding to COVID outbreaks in ways that have minimum possible disturbance. So the response to any outbreak now or in the future must include a social protection, food security, and nutrition element. And we must keep advocating for that as part of the new reality, what some refer to as building back better. And I think it's more about creating the new future has got to be including nutrition within it. And that will be my continuing remark here. Part of the food system implications of COVID is it's reminding us that very long food supply chains are actually a liability, and that actually resilience means having more local food systems. But at the same time, we have to remember that not every country can produce nutritious food locally and may have to bring it in from other parts of the country or from other countries or even other regions. So the notion of just doing it all inside the country, whilst attractive, may not work. I myself am very, very aware that people who are in drought-affected areas are going to need to be able to import nutritious food. They may be short of the necessary nutrients. So we've got to approach this, Chris, this resilience with a combination of building up short supply chain local systems and trying to make sure that they work, and introducing things like local warehousing so as to increase availability of food for more months, especially if possible refrigerated warehousing or drying of perishable produce. But we must link those with global systems as well, because not everybody can be self-sufficient. We know that in nutritious food. So I hope that's okay. Just the last point, who's going to be responsible? Remember, right at the moment, there is not appetite in our world to give more responsibility and authority to the multilateral system. Whilst most countries would like to see a strong multilateral system, there are one or two countries that are actually fighting against multilateralism. And we're going to have to be able, all of us, to exercise leadership in our own communities. Governments are going to have to exercise leadership for themselves. Regional bodies are going to have to be practicing leadership, because it's not always going to be possible to actually have everything done by the UN and the multilateral system. We're not 2015, we're 2020, and the world is a very different place. So whilst you might want to give more leadership to the multilateral system, and I would encourage you to try to do so, as we come up, for example, to the World Health Assembly, just 4 days away, we are in an environment that is very contested. We're all going to have to take responsibility, Chris. We can't rely on somebody else to do it. And that's what Sun is all about. Back to you, Gerda. You're muted.
Anna, translating the French and Spanish questions. And I would like to summarize different questions to one, because they are a little bit alike. Question from Mohamedou Lamine, from Adi, from Behir, from HP. And the question is how to make sure that medical treatment in hospitals is connected with the right nutritional treatment. That is one question, and how to make sure that people trust going to the hospital, because we hear from several livelihoods that people are keeping their children and their families home because they fear the fact that children or family members might become infected if they are to go to visit a hospital. Then I would like to also put a question in front of you from Leonard Mizzi. And he says he's from the European Union, and he asked, we have a UN Food Systems Summit in pipeline. How can we work all in unison to work towards a seismic shift from business as usual model to a new narrative, from research to anticipate future pandemics, to target more the equity and quality aspect of food systems. So over to you, David, and to the participants, please continue, because I anticipate that we can have one or two more rounds of questions. David, please.
Absolutely. Merci. Ghada, were my answers to the last questions too long? Because I can always shorten. It just means that I don't try to put in as much explanation.
Sorry, no, please go ahead. Did you hear the questions?
Yes, I've got them. Thank you very much indeed. Number one, thank you. Merci pour la première question. C'est très important ce que vous avez dit. Mais je réponds en anglais. Si vous voulez, après, on peut peut-être avoir un petit discours en français. Okay? So, how to make sure that medical treatment and nutrition are properly aligned. That is so important. We all know that good nutrition is key to a well-functioning immune system, to strong body defenses. We know that if this virus affects somebody, if their nutrition is not good, then they are more likely to be ill and perhaps to die. So I totally agree. Medical treatment and good nutrition must go together, just like that, integrated. And I would like to encourage all of you to be very carefully thinking about ways in which hospitals can be sure that they've got good, nutritious food available for their patients, whether it's from their government or from local communities or from local businesses. This needs to be given priority. I understand that people are scared of going to hospitals. After all, we now have a new infectious disease with a dangerous and unpleasant virus affecting people, and they will be in some hospitals, possibly even undiagnosed because of lack of testing. So people will be frightened of going to hospital, and they won't go for other conditions, the non-COVID conditions. Then the health workers are going to be busy on COVID, and they won't do routine immunization or malaria treatment. So yes, health systems are going to get disrupted, and people are going to be and are scared. There's no simple solution to that. But I do ask everybody who's working in healthcare or in hospitals to think very hard about how to separate the hospital work that's to do with COVID from other parts of hospital care. We've learnt that from many countries now. You have to be able to separate. You have to enable the staff who are working with people who've got COVID to have their protective equipment and to be in a separate place from the staff who work on non-COVID, just to try to prevent a hospital from becoming a place that's risky for anybody who goes anywhere near them. I have no simple answers to it, but I'm asking you all to recognize that COVID is making people scared of hospitals and even scared of health workers. I've heard accounts in many different parts of the world where health workers are being stigmatized because people say that they are are threatening because they might have the COVID virus. Let's work on this all the time. Conversation, discussion, even talking about the bad and different things, even talking about the conspiracy theories. Get talking, get discussing. The Food Systems Summit is being planned for 2021. The Special Envoy for the Food Systems Summit, Dr. Agnes Kalibata, has been working with others, including myself, on how to make sure that the Food Systems Summit recognizes that COVID is revealing inequities and inconsistencies inside food systems everywhere. She has asked us all to introduce into whatever we're contributing to the Food Systems Summit, a big focus on equity, a big focus on consistency about how food systems need to behave, a big focus on food quality, in order that the Food Systems Summit tunes in to the growing recognition that food systems are too fragile and are not resilient, and that this must be at the center of the agenda. Leonard, I'm sure that you are either indirectly connected or even directly connected to the planning for this Food Systems Summit. I'll tell you what I know, that Dr. Kalibata and her Secretariat team want to be sure that in the preparation for the summit, there is an intense process of engaging people who are working on health and nutrition, on livelihoods, on social protection, on environment and climate, and indeed on any other aspects of agriculture, fisheries, food and nutrition, that these are all engaged in the preparation of the summit over several months between the second half of this year and the first half of next year. An engagement that recognizes that because of COVID, normal meetings will probably not take place. She's doing this, of course, in very close cooperation with different parts of the United Nations, including FAO, the World Food Programme, and the International Fund for Agriculture Development, as well as with the Sun Movement and other parts of the multilateral, multi-stakeholder system that exists. She wants to be sure that there is engagement at regional level, at country level, and at city level, and she would like there to be dialogue everywhere about, as I said, inequities and fragilities in food systems that are being revealed by COVID. And if anybody wants to know any more about this, I do encourage them to tune in to the preparations for the summit. It's a bit too early right now. They've not got their full communications capacity in place. But as soon as there's information about what is possible, then I'm sure the coordinator and others in the Secretariat will be able to help. As I say, the summit is still being prepared, and the first advisory committee meeting, when the whole structure of the summit is going to be agreed, chaired by the United Nations Deputy Secretary General, is due to take place sometime soon, but it's not clear when it will be because of all the usual challenges right now, that everything is a little bit confused on planning and implementation. I hope that's okay. I now stop and go back to the coordinator.
I have a question from Santiago Giron from Guatemala, who is asking whether there is a special attention for Latin America and guiding them to cope with COVID-19 related to hunger and malnutrition, because in Guatemala are already so many malnourished people. I don't know whether you will answer to this, David, but let me say something from the Sun perspective. Your regional Central American organization, SICA, is very active in this field and is working with government, but also with different stakeholders and Sun Movement focal points to respond in a coherent way, as was explained by David just. to make sure that nutrition is involved in any treatment, that disruption in food systems are avoided as much as possible, that there is social protection, and the government needs to have an extra eye on those people who are already in need, who will be hit it hardest. That brings me to the next set of questions, which are from Habib from Ghana, Iqbal from Bangladesh, and Kiran. And the global message, because they are about the same, is COVID-19 has created an extraordinary situation, especially for the least developed countries. The economic impact on them is going to be devastating. Against this backdrop, how can richer countries, developed countries, Western countries, support these countries to mitigate the depth of the crisis, the economic crisis, the poverty crisis, and the malnutrition crisis, and support recovery and building a new future, leaving no one behind? It's a summary of the several questions I got. David, over to you.
Thank you very much indeed. I'd just like to say a word to Santiago, building on what you said. I am so impressed that in Latin America, there is a regional agreement now about the flow of food between countries. I love it when we see parts of the world that are doing really well. And I love the lessons coming from so-called developing regions that, frankly, the rest of the world could take note of, because the collaboration in Latin America on food and nutrition is so strong. I salute you all. I'd also like to say that in Latin America, some of the data coming through on COVID, on special situations, and on food insecurity is really strong. Again, much better than other parts of the world. Thank you. Thank you to everybody. Gracias. Merci. Obrigado. In Latin America, because you've got some big problems in Ecuador, in Peru, in Brazil, in the urban areas of Chile, and also in Buenos Aires, in towns on the border of the US, in Mexico. We've seen some of your problems, and we really, really salute your bravery, as we salute the bravery of so many other developing countries. And Habib, Iqbal, and Kiran, you're so right. You're so right. The rich countries' economies are being affected, and they respond by printing money and by having all sorts of extra financial support for businesses, big and small, for communities, for social protection. But where are the resources for poorer countries that have very tight payment situation, that have huge debt obligations, and also whose small and medium enterprises are actually becoming bankrupt at an incredible rate? They can't support them like the rich countries can. So they go to the International Monetary Fund. But the International Monetary Fund has not got a huge amount of money available. We are advocating, people like me, for the International Monetary Fund to have a much, much, much bigger line of credit that can be made available to poor countries, because the economic impact of this COVID is huge, and the prospects of extreme economic distress are great, and those will have a huge knock-on effect on people everywhere. So I'm with you. I'm so with you. Please keep advocating loudly for world leaders to understand that united global action is the only way to go, and that the people who are suffering the most from this crisis are poor countries, with the additional thing that many poor countries are linked tightly to the economies of rich countries, either through industries like tourism and travel, or because they're part of supply chains of commodities. what's going on? The tourism sector has basically stopped. So countries that have developed very, very well-established economies with strong tourism base, like Costa Rica, a member of the Sun Movement, are having to cope with the fact that there are many, many hundreds of thousands, perhaps even 1 million people who are unemployed. Regular jobs in the tourism sector have gone, and partly also because informal economy jobs that are linked to the tourism sector are really, really difficult right now. And the tourism sector will not recover until the world is able to get on top of COVID. So I so agree with what you've said. And we really need a global advocacy campaign on debt, on balance of payment support, and on private sector debt relief. Our colleagues from the Economic Commission for Africa are doing such a lot. Vera Songwe, the executive secretary, was talking to me just the other day about this. Colleagues internationally, like Helen Clark, the former Prime Minister of New Zealand, Gordon Brown, the former Prime Minister of the UK, the President of the African Union, the chairperson, the head of the African Union Development Agency, and the Inter-American Development Bank, and also the Organization of American States. They're all focusing on this. It is acute. This is a recession coming like none we've ever seen before, much worse than 2009. And our advocacy now is more important than ever. Thank you.
Questions are coming in, and I just would like to encourage you, please move on. I have two questions available. There is a lot of chatting also about the risk that caretakers and people working in hospital and medical people, that they are thrown out of their houses, that they are treated very badly. So it is important to stay strong for them and to tell the right story, that they are there to support people and keep people alive as they can. But I have a question from MR Tolukdar, who asks, how can research and science help in this very complicated situation, where health and nutrition are coming together and also are revealing other problems in the world, in the social fabric, within countries, etc. So a little bit broader, what can we learn and what can we ask from academia to also find science-based solution? I have another question from Kaik Izushi, who is asking, the WHO is questioned by some political leaders. How do you move on as WHO in leading in this critical situation? Then I have a question from Sidikou from Niger. What will be the impact of COVID-19 on food and nutrition security in the coming months, especially in countries with high rates of malnutrition? A lot of the same of questions are the same, but people want to hear your reflections, David. And then a question from Laurent Michel. It is about, shouldn't be obesity prevention and the promotion of better nutrition be a priority for all governments, and not only for governments in Sun Movement current member countries? And the question from Mac: how do we convince a government in developing countries to put nutrition on the agenda when several different sectors of government are struggling to stop the transmission and at the same time struggling to address an emerging economic crisis. It's all focused on how do we do it at country level, and how are we making sure that the government is taking the right measures right now in this hot crisis, not forgetting people and not forgetting the importance of nutrition, because we cannot fail a next generation of stunted children, handicapped for the rest of their life. Over to you.
Thank you very much indeed, Gerda, and thanks to everybody. Thank you for yourself raising the challenge of health workers, all of you. And I just want to echo Gerda's words. Health workers are the heroes of the hour. Actually, it's everybody involved in health and well-being. People involved in mental health as well as physical health, people involved in violence prevention, as well as all other conditions besides COVID, essential workers who provide what's needed for good health. You know, I was listening to a comment yesterday from Mike Ryan, the head of the emergencies program in WHO. He said society has just not given enough recognition to the importance of public health and well-being. It's taken it for granted. But you can't do business, you can't have an economy. It's absolutely essential to put health workers at the center and to give them all support, all love, all backing, because without that, you know, we're just not giving support to the most important people. To Mr. Talukdar, actually, I want to really stress to you that we need science to produce evidence, and also to question evidence and to perhaps readapt our hypotheses more than ever. And it must be completely liberated science where people collaborate across disciplines, across institutions, and across countries, because this problem is so huge that it's only by using the total collective capacity of the brains of every single human being that we will be able to get ahead of this virus. I can't stress it enough. But it's not just biological science, it's management science, it's social science, it's actually all science, all science. So yes, we need to study the virus. Yes, we need better diagnostic tests and better treatments, because there aren't any at the moment. And we need a vaccine. But we also need to study the systems that are really working together. We need the science to investigate the interplay between different systems. And we need science to observe and then to test out the responses. Which are the responses that work best? We need managerial science to develop better logistical operations. And so, yes, science, but complete science, interdisciplinary science is key right now. A kind of science examines hypotheses and even tries to disprove them, so that we learn through finding out that our models and our understanding was just not good enough to explain what is happening. I am changing my position on what needs to be done in this virus all the time, because I'm learning all the time through science. I'm connected both through scientists in my own university in London, but connected to scientists all over the world. So, Mr. Talukdar, I absolutely really appreciate your point about the need for science. To, I think it's Mr. Zushi, a little bit about the World Health Organization. Every time there's an outbreak, quite correctly, there is a very, very intense review of what's done, what's called an after-action review. I was involved in Ebola 2014, 2015. We were subject to intense scrutiny. And then I worked to help WHO completely reform its program on outbreaks and emergencies. And in fact, it's not bad. It's going very, very well. But there are some people who are saying, as correctly, couldn't things have been done quicker? I know what happened every day between December the 31st, when WHO was first informed about a cluster of atypical pneumonia, through till January the 30th, when WHO declared a public health emergency of international concern. And of course, there will be a deep inquiry. Could it have been done earlier? Could more have been done to stop that virus coming away from Wuhan, where it was first discovered? Absolutely. We all need to be called to account, every one of us, and we should be. But it's really difficult if in the midst of all this, there is suddenly the emergence of a really acute attack on the people of the World Health Organization while they are dealing with the problem. And that is making life super difficult. So I quite understand that you must be worried. Let me just give you my word as a public health professional of 45 years. Every single person in the World Health Organization just works with one set of values. That is for the health of all people, regardless of their nationality, their sex, their age, their wealth, their ethnicity, their religion. There's no bias. There's none. But remember, the WHO Secretariat, these are the technical people, work under the rules provided by the member states, 194 of them. They set up a thing called the International Health Regulations in 2005. And I was involved in that negotiation as a member of the Secretariat supporting it. And I watched the countries be very clear on one thing. WHO does not have the powers to do inspections, and certainly not unannounced inspections of countries to see what's going on. WHO must rely on official information provided by the country. If the country does not provide the information, then WHO has no right to go in and demand it. So Dr. Tedros went to China and he asked the president, please can WHO send in an inspection? And the president of China said, yes, you can do whatever you like. It will be a joint inspection, China and the rest of the world, including Americans. And they went in and they got out a mass of data. And those data said one thing. If COVID arrives and you're certain it's COVID, react immediately, rapidly, without delay, robustly, like many, many countries have done since. Not every country did that. Not every country did that. But the lesson that was found in February from the inspection was clear. So from our side, we're happy to say to you that WHO followed the rules that have been set, that WHO got the information with an international team, with people from all over the world, and that WHO provided that information without any restraint to every country. You have COVID, you react quickly and robustly, just as many developing countries have done, but not every country did that. Now I'd just like to say a couple of more things. A bit to Mr. Siddiq from Niger.
Actually, David, you have one more minute because people need to leave. It's 2:00, 2:01. Please respond to the obesity.
I'm going to do it now. Thank you.
And then finalize, because many people want to applaud you, and I would like to close this and say a few words. Thank you.
Obesity is a form of malnutrition. Obesity gives a very high risk of COVID-related death. This shows that malnutrition is a global issue and that it matters. And we have to reduce malnutrition at both extremes in order to improve survivals from COVID. Thank you, Laurent. And then just in the coming months, this is going to continue to be an issue, It's not going to go away suddenly. So we have to keep working on it. And all aspects of nutrition, including being careful on ultra-processed food, have got to be taken into account. Remember, frontline workers like food merchants, drivers, cleaners, keep life going, even in very strict lockdown. Prioritize them. They're often the least valued members of society, unfortunately. What happens at country level really matters. That's where decisions are made to leave no one behind. I must leave you behind now. Thank you. I know time's run out. Sorry if I went on too long. With fondness to you all, Namarro. Thank you very much. Obrigado, gracias. And good wishes to you all. Sun movement is more important now than ever before. Thank you.
Thank you very much, David. And I reflect already thank you very much and very interesting meeting in the chat box. My people have been thinking that I could summarize this conversation with you. I cannot and I will not, but one thing is clear: health and nutrition need to walk hand in hand during this crisis, in recovery and in building back better and stronger, or creating a new future. Food systems need to be reflected upon, because the food systems of the future need to serve the health of people, but at the same time respect the health of our planet. And we can only respond to this crisis if we are ready to trust each other and to work hand in hand. UN, government, different sectors, civil society, private sector, if donors are ready to step up and step in, and there is no one trick that can do everything. It is by people working together that we can overcome this and build a better new world in which we leave no one behind. Let me say the same to all the people who have participated so actively. They are still sending messages. Let me invite you to come to our website if you have specific questions to the Sun movement. We will be happy to respond. I see already that there are people asking for a next meeting. I'm quite sure that David will be available and we can consider what we will do. But let me say thank you very much to David, and I applaud you again for all the good work that you are doing. And let me say thank you very much. Obrigado, obrigada, muchas gracias, merci beaucoup. Thank you so much for all the great participants and the organizers of this webinar. The webinar is closed. Thanks.
Bye-bye.